Hi, I'm Dr. Larry Wyatt. Welcome to Radiology Grand Rounds.
Hello everyone, this is Dr. Larry Wyatt with Radiology Grand Rounds. Thanks for joining us. Our case this week is that of a 56-year-old black male with progressively worsening headaches. He was x-rayed, his skull was x-rayed, and this is a lateral view of his skull, depicting from the vertex through the base, although the mastoid processes are not included, and from the anterior portion of the frontal sinus to the external occipital protuberance posteriorly. Overall, the bone density in this gentleman appears mildly decreased, but the hallmark finding is a very large, approximately 5 centimeter, relatively round lucency overlying the coronal suture on this lateral view. It is located at the apex near the vertex of the skull. It is almost punched out in appearance. There is no definitive evidence of any sclerosis surrounding the lesion. Nor is there any evidence of a soft tissue mass. There is some suggestion of some widening and accentuation of some of the venous grooves on the inner table of the skull, particularly these two here that I just outlined. Sinuses appear normal. Celotursca appears relatively normal, although there is some depression in the anterior clinoid process, but I suspect that's probably a normal variant. What you see here is overlying soft tissues, the pinna of the ear in this patient. These findings in a relatively young black male are consistent with multiple myeloma as a diagnosis. In retrospect, when one sees the very large lesion here, we're taken by that lesion, but there is suggestion that there may be some smaller areas of lucency located within the skull as well, although they're not as completely well defined as the large one. Multiple myeloma is a reticuloendothelial malignancy where myeloma cells are produced. They invade the bone marrow and are found particularly in the flat bones and in the spine. So the skull, the spine, and the pelvis are the areas that are most commonly affected. We see these what are called punched out lesions with very sharp borders as opposed to cases of lytic metastasis where the borders of the lesions are much less well defined. So this is a relatively textbook case of multiple myeloma involving the skull in an upper middle-aged black gentleman. Thanks for joining us for Radiology Grand Rounds, and we'll see you again soon.